Maybe my first thing I would remember is sitting on like the corner of my carpet in my living room at our old house, and my whole family was like unloading groceries, and I was just kind of sitting there rocking back and forth on the ground because I was in pain and I couldn't move.
At age 7, she was diagnosed with the Crohn's disease, and her main symptoms at that time was abdominal pain, weight loss, and then she was actually having blood in her stool. It's a very common presentation. What is a little uncommon is actually her age.
Crohn's, a type of inflammatory bowel disease, or IBD, affects as many as 3 million people in the U.S., including 100,000 children. Children with Crohn's are usually diagnosed in their teenage years, but the IBD Center at Cincinnati Children's is seeing an increase in younger children.
When they told us she has Crohn's disease, I didn't even know if it began with a C or a K.
Right.
I didn't know how to spell it. I didn't know what it meant. So that was how our journey started.
I guess it was kind of scary that they had a name for it because that meant like, okay, I actually do have something, but I was also kind of relieved because then I realized, well, now I can be on the step forward and I can get better, hopefully.
Now 18, Allison is doing wonderful. Her journey was difficult though. After her medications failed, she had an ostomy bag for almost 3 years to allow her intestines time to heal.
Things really turned around for her when she got her ostomy. We were kind of nervous about that, but when she was able to have her system rest, you could really see improvement in her over those years. She had her reversal just after she started her freshman year in high school. And then within a year after that, she was running cross country on the cross country team.
I go to school fine. I don't really need any of the accommodations that I needed before. I feel like I'm pretty much normal besides the fact that I have like shorter intestines. I have to get infusions every 6 weeks.
She's a tough kid. She's come a long way, and she's this whole time, despite all these surgeries and everything that she's needed, these infusions and these different medications, she's still doing the things that she wants to do.
Talking to another teen with Crohn's through the IBD mentoring program helped Allison through some of the toughest times. She's now a mentor, and her parents are involved in several groups devoted to supporting IBD patients and their families.
It's definitely a pay-it-forward type atmosphere that we wanted to be involved with.
In addition to connecting families, the center takes a team approach to care with a goal toward improving outcomes.
So many options, and there are so many medicines that are coming out that you can try and you will get better.